out to the body parts to tell the body how to work. This is what we call interference. Now, many things can disrupt the messages from the brain out to the body, and the movable bones of the spine are most commonly at fault. Poor motion or incorrect positioning can irritate, pinch, or press on those nerves, disrupting the signals out to the body parts, and this is what we call a subluxation. Now, I ask you, if the misaligned or subluxated bone in that baby happens to be the one that goes to the inner ear, what do you think the baby can develop?
Ear infection.
Ear infections, right? Which is considered somewhat common in the first year of life. And then the babies have to go on what? Antibiotics. Okay, so this is the mechanism, and this is what happens. This little baby, normally, when you have normal nerve supply coming from the top two bones of the neck, C1 and C2, remember that atlas, how it's supposed to be angled down, right? That allows for normal nerve supply to the inner ear, more specifically the muscle that pulls the inner ear down. So when those muscles get proper nerve supply, they pull the inner ear tubes down, and when there's congestion or fluid or what have you, it just drains like it's supposed to, right? Now, let's say there is a subluxation and a pinch or a pressure on the nerves in the top part of the neck. And now that nerve is pinched upon and doesn't get the proper nerve signals out to the muscles of the inner ear tubes or the inner ear canal. So what happens? It doesn't pull those ear tubes down anymore. Now they go more horizontal. And what happens when fluid or congestion gets there? It doesn't go anywhere, right? It stays right there, becomes the perfect breeding ground for an infection, right? So then little Johnny's got to go to the pediatrician, get on antibiotics, whatever. What happens the next time he has a cold? Or the next time he has congestion? Same thing. Happens again, and then maybe again and again. How many of you know children or babies who have had multiple ear infections as a child? Or maybe you were one yourself, right? You were one of those children, right? And then eventually you have to get tubes surgically pushed in the ear canal to artificially push those ear tubes down because they claim the body doesn't know how to do it itself. Well, when I tell you, this is why I'm so passionate about adjusting and treating children, especially babies. Because the first year of life, they go and they're exposed to so much. So little finger pressures is all you need to adjust a teeny tiny baby's nervous system or cervical spine to open up that nerve system to allow for the body to self-heal without drugs at all. It's amazing. It's absolutely amazing. So if the misaligned or subluxated bone in that baby happens to be the one that goes to the lungs, sometimes that child can be asthmatic. And you've seen it. I mean, asthma is like crazy. How many kids are on inhalers, nebulizer treatments, steroids? I mean, it's incredible how sick some of our kids are. And if the misaligned or subluxated bone happens to be the one that goes to the digestive system, sometimes that baby can be colicky or have some kind of digestive disturbance, acid reflux. That's the latest and greatest. I love it. A baby that spits up. Now they have reflux. Don't get me started. Okay. Now that we've talked about what causes subluxations in our babies' bodies, let's talk about what causes them in our adult bodies. Stress, stress, and stress. Emotional stress, chemical stress, and physical stress. So emotional stress, we worry about everything, right? We worry about our health, we worry about money, we worry about our kids, we worry about our homes, paying the bills, going to school, right? Making ends meet, our relationships, we're in a fight with somebody, right? And when you're under, we already touched on it, but when you're under emotional stress, it literally causes your blood pressure to go up, causes your immune system to become depressed, so you get sicker quicker when you're under a lot of stress, right? Also can give rise for inflammation in the body, especially in the digestive system, in ways like ulcers, ulcerative colitis, things like that. So it can be destructive if we don't know how to manage our stress. How about chemical stress? Well, I mean, we all love our coffee, right? We need our coffee to get going throughout the day, which is a nerve system stimulant. And then we all go home and have a glass of wine or a drink to calm us down, nerve system depressant, right? And then there's some things that you just, there's some things that you can't avoid. Pesticides and hormones in some of our foods, our fruits, our vegetables. It is hard to get away from that stuff, but that is a source of stress on our bodies. all the GMO foods that we're eating now, and pay attention. GMOs are a hot button topic for a reason. They're dangerous for the human body. If you can get your hands on anything about GMOs, know that we have to do something about the genetically modified foods that we're feeding ourselves and our kids. And then all the drugs that we take, right? All the medications that we think are safe, but on some level maybe affecting our livers, our kidneys, maybe our digestive systems, right? All adds up. Real quick, back to organic food and eating pesticides and chemicals in some of our foods. I think one of the best tips I ever heard was from Michael Bloomberg, who was the mayor of New York City, who is not anymore. But he was putting out public service announcements. I was like shocked on New York City radio, which I think was fabulous. And one of his public service announcements was about organic eating, and they said, I get it. It's very difficult to eat all of your food and everything that you eat organic. Not only is it expensive, but it's sometimes difficult to find, right? Well, I think he said the best thing that you could do is just pick the top 5 most commonly eaten foods that you and your families eat. So if it's milk every day, or certain dairy, or maybe you love apples, or you eat a lot of salad, or certain meat, if you eat beef once a month, who cares? But if you eat chicken 3 times a week, then maybe you should make your chicken organic. You see what I'm saying? So think about the foods that you eat most commonly throughout the week and make those organic. Spend the extra money on your health that way. Does that make sense to you guys? That's a good tip. All right. So we tend to notice the subluxation. Oh, I forgot. My last one. My last stress. Okay, so the last stress we have is physical stress, right? Which is the common stuff. The most obvious things. Your car accidents, your sports injuries, right? Your slips and falls. All the hours we sit bent over a computer all day long, right? Or maybe we're manual workers where we're up and down, helping people, lifting people, bending, or manual laborers where our guys are up on the roof or up and down a ladder or lifting heavy things. I mean, all of those things add up and cause subluxations in our bodies and stress on our bodies. Except we go back to our old programming. Well, I feel fine. No pain, no problem. I must be healthy, right? Very dangerous cycle. So we tend to notice a subluxation when it causes a symptom like pain, but now we know that there's a lot of other nerves involved when you get subluxated. So say, and we know now that these nerves also control all the other functions of our body. So of all the 100% of nerves that you have in your body right now, right, inside every one of those nerves are 10 tiny little nerve fibers, microfibers, right? And of all those 10 tiny little nerve fibers, only about one of those, maybe 1.5 of those, is for what you feel. The other 8.5 or 9 of those microfibers, or let's just say the other 85% of your nervous system, is actually for function. So you don't feel necessarily something that's going on, but those nerves are absolutely controlling those other parts of the body. So like we just touched on with the cancer analogy, right? Or maybe it could be, maybe something's going on with your liver, your spleen, your kidneys. You don't necessarily know what's going on, but those nerves are the same nerves that are controlling those parts of the body as well. So you would have to subluxate that bone in just the right way. Or maybe you don't necessarily have pain, but that nerve supply to those body parts could not be as healthy and strong as it possibly could be, which is why I adjust the entire spine. I free up your entire nerve system so that your body can heal and have maximized function to every single part of you. Does that make sense? Okay, we're almost done. So let's talk common sense. So we do all this stuff to care for our teeth, right? We brush and we floss and we go to the dentist and we get caps and crowns and braces and right? No one wants ugly teeth. Now teeth are made out of bone, just like your spine. Now what are all the things that we do to care for our spines? There's no real ritual out there, not yet, right? To care for your spine. I hope to change that at some point in my career. I think everybody should have their spine checked at one point in their lives because it is so important. If your spine is subluxated and out of alignment, you may not feel it, like we just mentioned, but it is so important to get it cleared out so that it doesn't cause any future problems in your life down the road. Not only that, if your teeth decays, what do we call that? What do we call that when you get a little erosion of your teeth? What is it? A cavity, right? And what do? They drill it out and they fill it and you're good to go.
With poison.
What? With
Poison.
Sometimes, yes. We don't want mercury fillings.
Yeah.
All right. What do they call it when your spine starts to decay? What is that called? Degeneration, or more commonly, arthritis. Now, can you drill that arthritis out of your spine and get rid of it?
No.
I wish you could, but you cannot. Once we have these arthritic changes, you have them. The best thing that we could do is maintain proper spinal alignment so that it doesn't progress and worsen down the road, because that unfortunately does happen if we don't keep ourselves nice and healthy. Which is why you're here. Ta-da! Chiropractors, find those areas of the spine that are subluxated. Find those areas of the spine where there's starting to become early degenerative changes and arthritis. Find those areas of the spine where there's a lot of muscle challenges and pain. And remove those subluxations with adjustments so that in the end your body can heal itself without drugs, without surgery, the way that God meant you to heal. Things start to communicate better, cellular level, on the organ system, visceral level. Everything just works better when your body's well adjusted. On a personal note, I have been getting adjusted since I'm six-ish around. My mother was going to a chiropractor because she had chronic back pain, and I had chronic strep throat and tonsillitis. Chronic, with lots of penicillin back in the 70s. And everybody got their tonsils out. That's what you did. Everybody just got your tonsils out in the 70s, right? My mother was going to a chiropractor who kind of did not really, who's very similar to me, who adjusted families and children, and said, well, let me check her. Bring her to me. Let's see if there's something that we can do to prevent this surgery. I was a little kid. So my mom was cool with that. She was like, okay, let's try. What's the harm in trying? Maybe we could put this off. And he checked my spine, and he noticed I had subluxations in my neck and throughout my spine, and he started adjusting me. And I never, got strep throat again until, my college years. Never again. It was that dramatic in my life that I never, ever got it again. And my brother had a similar issue with allergies. His allergies were he was on so many medications. He was off all his medications. So it was a dramatic change for our family. It was a dramatic change for our family. So I find that when people, it's so much more to me about back pain and neck pain than it is about, that people think. It really is. So if you're thinking of someone right now who could potentially use an adjustment, or you know someone who's not so healthy and would like to be healthier, then I have gift certificates for you. I don't do this to anybody, only my existing patients. This is a full workup in my office. Chiropractic exam, digital scans, digital posture. We'll take x-rays if necessary, all for no charge because you referred them here. So please only take one of these if you really know someone that you think could benefit. Don't take these for, just to throw it away. All right? Really only take these if you're serious about helping somebody. And on a final note, I also go and speak at many organizations and businesses and schools, etc. So if you have an organization or someone you would like me to come and speak at, I'd be happy to do that. We do breakfast, we do lunch workshops where we actually bring lunch and then speak on a topic. We have a kind of a list of topics that we can speak on. Even a group as small as 10 to hundreds we've spoken to. So please, if you're someone you would like me to come and speak, by all means, contact us or let me know, and we'd be happy to do that. All right, any questions? Thank you so much for coming, everybody. I hope you have a great night and a great rest of your week, and I'll see you soon. Thank you.